Do you have an appointment? Great. Okay, well you're early, but that's perfectly fine. We prefer early rather than late, so can I get your name, please? Wonderful. Okay, I found you right away in the system. So you're a new patient, right? Alright. Well, yeah, if you're nervous, there's nothing to be worried about or anything. We're very experienced, and we actually specialize in kind of more nervous patients, so you're in good hands, trust me. I'm actually just going to ask you a few basic questions. I can see that you've already mailed in that introductory form that we have all of our new patients fill out, so thank you so much for doing that. It just makes the process a whole lot easier. There are a few questions, though, that I have to ask you here, if that's all right. Great. Okay, so are you currently having any dental issues at the moment that we should probably take a look at while you're here? Okay. And are you experiencing any pain whatsoever in your mouth, such as in your gums, on your tongue, anything of that nature? No. Okay. Do you have any major medical conditions right now that we should know about? No. Okay. And are you currently on any medications, especially blood thinners and things like that? No. Okay. Wonderful. Okay, yeah, that's all I needed to know. Is all of the information you gave us on the form still current and correct? Great. Okay. Well, I'll have you take a seat then just for a moment, and then I'll call you back and we'll start your just basic dental examination today, right? Regular checkup? Okay. That's not a problem. And there's plenty of magazines out there, and we also have some tea and water, so feel free to help yourself. Great. Alright, are you all ready to come back? Okay, well, the dental hygienist is ready to see you now. She's actually going to be the one who's just kind of looking over everything and making sure that there aren't any problems. Okay? Great. Hi there. My name's Elizabeth, and I'm going to be the one who's giving you your checkup today. Now, before we get started, are there any questions that you have for me, or no? Okay. Well, if you do feel uncomfortable at all during the appointment, or you have any questions that, kind of come up, just feel free to please let me know, and I'll be able to address any concerns or questions that you may have, okay? Okay, I want you to be as comfortable as possible is the main goal. I mean, I know that we're trying to take care of your oral health today, but I also want you to kind of feel more relaxed, all right? Great. Okay, so I'm just going to adjust the chair a bit here. Raise it up just a bit and recline it so that you're a little more comfy, okay? Alright, is that better? Wonderful. So I'll be putting on these gloves. You're not allergic to latex, are you? Okay, great. was your last checkup, by the way? When was your last dental exam? Okay, so it wasn't too long. Okay. So what I'll have you do is I'll have you just kind of relax as much as you possibly can. And just open your mouth for me kind of wide. And I'm just going to take a brief look inside and see what's going on in there, okay? Okay. Yeah. Looks like everything's good just from first glance. It doesn't look like you really have any cavities or anything. I'm just seeing maybe something kind of over kind of your molars. Okay, you recently had that treated. Okay. Just didn't look like a bit of a crack there, but I do see there that I see the filling. Okay, looks like that's holding up nicely too. Okay. Have you ever had braces? Okay. Well, just your teeth are they're so straight and beautiful. Okay. I'm just going to take a look at the top now then. And everything looks great up there too. Okay. Okay, you can close your mouth now for a moment. Okay, so as I said, everything looks like it's doing well. I think the only thing I'll pretty much do today is I'll kind of clean your teeth, just kind of just a general cleaning, nothing too deep or anything. And then I might just apply a simple kind of fluoride treatment to your teeth, just to kind of strengthen them. Now when we do the teeth cleaning, I actually won't be doing any scraping on your teeth. We use a new product here. It's kind of a new technology in the dental field, and it's a cream that I apply directly to your teeth, and it gets rid of all the plaque buildup that you may have along the gum line there and in between in the gaps of your teeth, and so no scraping's involved. Yeah. Well, a lot of our patients were a little bit uneasy about the whole scraping process, and it made them feel uncomfortable, so we found this product, and yeah, we find that it works really well. Alright, so I'll be using this, and I'll just kind of mix it up here, and then I'll apply it to your teeth, just a thin layer of it, and then I'll rinse it out, and after I rinse it out, we'll just apply a light layer of the fluoride, and that's a leave-on treatment, so you'll leave that on for the rest of the day, and then you can kind of brush it off tomorrow morning, okay? Okay, great. Just give me a minute here to get the cleaning solution kind of ready, the cleaning cream, and then I'll be right back, okay? Great. Alright, the cleaning cream is all set. I just mixed it. It just comes in powder form, and I just have to combine it with water. So that's all ready to go. So what I'm going to do is I'm just going to take a bit of it at a time on a little application stick that we have. So I'll have you open your mouth, and I'll start with the bottom row of teeth, and then we'll move on to the top, okay? Okay. So let me have you open your mouth. There we go. Okay, and I'll just apply it there with a stick. Okay, I have a good amount here, so I'll just put it right on your teeth, okay? Just gotta open as wide as you can for me. Okay. applicator stick here actually has a little brush at the end, just to make sure we can get in all the crevices of the teeth, in between the teeth, that sort of thing. It's much gentler than the scraping though, of course. Okay, now I'm going to go ahead and move on to the top row. Okay, are you doing all right? Okay, great. Let me get some more of the cream. Okay. Yeah, and you don't have to, I don't have to use much pressure at all. It just kind of, the cream does all the work for me, so it's, yeah, it's sort of soothing. Yeah, the brush does tickle your gums a little bit. I know, I'm sorry about that. Okay. So we're all through with that. So I'm going to actually let that sit for about 5 minutes, just so it can kind of soak into your teeth and get rid of all the plaque and all any debris that you may have in there, okay? So, yeah. Yeah, it is cherry flavored, yeah. So there shouldn't be any discomfort, really. It doesn't tingle or burn or anything. If you do feel anything, please let me know right away. But I'm actually going to leave the room and just let you relax for a few minutes. So, well, as much as you can anyway. All right, well, I'll be right back, and then we'll go ahead and rinse that out, all right? Wonderful. All right, I'm back. Are you still doing okay? Okay. So what I'm going to do now is I'm going to just take a look, make sure it worked properly, and the cream that I put on, and then I'll go ahead and rinse it out, and we'll do a little bit of suction just to get all the water and any last remaining debris out of there, okay? Okay. So let me take a look at your bottom teeth there. Yeah, everything looks great. Same thing with the top row. Okay, wonderful. So I'm going to just place some water in there, and then we'll go ahead and suction that out. So you're going to hear a little bit of a strange noise probably when I'm suctioning, but it'll be very brief, and you shouldn't feel any pain or anything, okay? Alright, we're all through with that. So what I'm going to do now is I'm going to get the fluoride treatment ready, and this is going to be a little bit thinner than the cleaning solution was. It's almost like a gel, and I'll put it on both rows of teeth, both sets of teeth of course, and then we'll just let it sit, and you're actually going to let it sit for the rest of the day, and then just kind of refrain from brushing your teeth tonight. I know it's kind of odd for a dental hygienist to say that, but in this instance, you need to let it really soak into the enamel of your teeth, into the teeth, the tooth itself. So I'll apply that. So just don't brush until tomorrow morning, okay? Okay, so I'm going to get that ready real quick. I have all the things here I need for it, and then we'll just apply a thin layer of that. And this is bubblegum flavored, so it should be good as well. Okay, I'm going to apply it just to the bottom layer first, okay? Or the bottom row, okay. Okay, it looks good. It's going on smoothly, so that's nice. So then I'm going to move on to the top row. Okay. So we've applied all of that. Yes, generally some dental hygienists like to use trays. I prefer to just brush it on with an applicator because I feel I can really get into all the areas that sometimes the tray might miss. So yeah. Okay, well, we're done with the fluoride treatment then. Overall, your teeth are in great condition. I really don't have any suggestions for you other than just keep doing what you're doing because everything looked great. Alright? Okay. Now, so you're not having any sort of pain at all right now, right? Okay. Well, if you do feel any discomfort, give the office a call. Unless it's, of course, it's an emergency, then, just come in if it's during opening hours or go to the emergency room. But if you don't have any discomfort or pain, which you shouldn't, then that's great, yeah. Yeah, you have my number on the welcome packet that we gave you. So you have even an emergency contact phone number that you can reach us after hours. So if there's any problems that do arise, feel free to give us a call, okay? Okay. Well, on your way out, go ahead and set up your next appointment. I'd like to see you again in another 6 months just for another quick cleaning. And that'll be it, okay? Okay, great. Well, it was great seeing you today. You have a great rest of your day, okay? Bye.